Good afternoon. Today I want to talk about a healthcare disparity that really hits close to home for a lot of us here in the Mid Ohio Valley, and that's substance abuse and the ability to get access to treatment. Looking at data from KFF, one thing that stands out is that addiction affects a huge portion of the population. About two-thirds of adults say they or someone in their family has been impacted by substance use. But here's where the disparity comes in. Not everyone has the same access to treatment. Even when people need help, fewer than half actually receive it. And when you break that down by race, white people are more likely to get treatment than blacks or Hispanics. That's the disparity. It's not just those who experience addiction, it's those who actually are able to get help. This matters because addiction doesn't just affect one area. It has impact on everything from mental health, finances, families, and healthcare systems. KFF found that addiction affects family relationships, mental health, and financial stability for a majority of the people dealing with it. When people don't get treatment early, they end up in the emergency room, admitted or worse, overdose situations that could have been prevented. And we see that nationality affects it too. The Office of Minority Health reports that Black Americans are significantly more likely to die from overdose compared to the general population, and that American Indians and Alaska Native populations are hit even harder. At the same time, Hispanic populations are less likely to receive treatment. So we've got a situation where some groups are at higher risk and others are less likely to be able to get care. Now let's bring that down to our area. In the Mid-Ohio Valley, addiction is not an abstract issue. It's something we see in our ERs, on the floors, in the EMS, and honestly in our own communities. Rural areas report higher exposure to opioids overall, which lines up with what we see here. Add in barriers like transportation, costs, stigma, and limited providers, and it gets even harder for people, especially minority populations, to get consistent treatment. So what do we do about it? First, we've got to expand access to treatment that works, like medication-assisted treatment, counseling, and long-term recovery support, not just detox and discharge. Second, we need to meet people where they are. That means making Narcan widely available, improving screening, and catching people early instead of waiting for a crisis. Third, and this is a big one, we must address trust and communication. The Office of Minority Health pushes something called cultural and linguistical appropriations standards. Basically, it means that we respect people's backgrounds, beliefs, and community needs. If a patient doesn't trust the system, they're not going to use it, and no matter how many services we build. And finally, locally, this has to be a team effort. Hospital, EMS, public health, schools, we must all be on the same page because right now the system is there, but for some people it's not reachable. At the end of the day, this disparity isn't about addiction rates. It's about access, trust, and outcomes. If we want to improve health in our community, we have to make sure that the treatment is not just available, but accessible to everybody. Thank you.